Welcome to The Explainer. Today, we're zooming in on the nervous system, but we're doing it through a very specific high-stakes lens. We're going to explore 4 severe, potentially devastating neurological emergencies. But here's the truly incredible part. Despite how extreme these conditions are, they share one incredibly powerful trait. They are all remarkably preventable. If you understand the mechanisms at play here, you literally hold the power to stop them before they even begin.
Okay, let's dive into this. Here is our agenda. We're looking at 4 distinct perils today: Reye syndrome, tetanus, botulism, and rabies.
Section 1, Reye syndrome, the aspirin link.
So, what actually happens when you mix a common viral illness, something like the flu or chickenpox, with aspirin? Well, in a child or an adolescent, the answer can be Reye syndrome. The exact mechanism connecting aspirin or salicylates to this condition isn't fully understood yet, but the association is absolute, and it is incredibly dangerous. Reye syndrome is a devastating dual threat. It doesn't just attack the brain, it goes after the liver at the exact same time. On one front, you've got encephalopathy. That's cerebral edema or severe brain swelling, which causes a spike in intracranial pressure. This is the most immediate threat to life. It leads to nausea, lethargy, combativeness, and can rapidly progress to a coma. Then, on the other front, you've got fatty degeneration of the liver, which heavily impairs your blood's ability to coagulate. But here is the critical takeaway. If this dual threat is caught early and supportive therapy is started right away, recovery is actually incredibly rapid and usually happens without any lasting damage. Because the stakes are literally life and death here, we have a non-negotiable safety rule. Never, ever give aspirin to a child or adolescent who has a viral illness. Just use alternatives like acetaminophen or ibuprofen for a fever. And you've really got to be vigilant here, because families often don't realize that salicylates are totally hidden in other over-the-counter products, like Pepto-Bismol. Always, always check the labels.
Section 2, tetanus, the rigidity toxin. All right, transitioning from a medication-triggered emergency to an environmental one, let's look at an acute toxin-mediated neuromuscular disorder. The bacteria Clostridium tetani just hang out in everyday soil and dust as highly durable spores that can survive for years. They're just waiting for an opportunity, which can be as simple as a minor scrape, a puncture wound, or an unsanitary cut. Once they get inside the body and find a deep, oxygen-free or anaerobic environment, they germinate. The bacteria multiply and release a potent neurotoxin that essentially hijacks the entire nervous system, leading to severe, agonizing muscle spasms and absolute rigidity.
The classic clinical presentation of this rigidity is lockjaw. The stiffness usually starts right in the jaw muscles. In fact, if a provider gently touches the back of a patient's throat with a soft instrument, instead of a normal gag reflex, the jaw muscles will violently and involuntarily clamp shut. From there, the spasms spread to the face, the neck, and the chest, severely compromising the airway. In severe cases, especially in kids, it actually forces the entire spine to arch backward in a rigid bow. It's a terrifying condition known as opus thetonus.
Section 3, botulism, the paralysis toxin. And this brilliantly illustrates the functional contrast between these two toxins. If tetanus is the toxin of rigidity, botulism is its exact polar opposite. See, tetanus blocks the inhibitory signals in the nervous system, meaning the muscles are constantly getting the signal to flex, hence the rigidity and lockjaw. Botulism, on the other hand, blocks the excitatory signals, specifically acetylcholine at the neuromuscular junction. This means the muscles just can't get the signal to contract at all, resulting in profound muscle weakness and flaccid paralysis. 2 different environmental toxins, 2 completely opposite mechanisms of neurological failure. Now, while adults typically get botulism from eating preformed toxins in improperly canned foods, we really need to focus on a very specific vulnerability: infant botulism. In babies under 1 year old, and particularly right around that 3 to 4 month mark, their digestive tracts just lack the strong gastric acidity and mature gut flora of an adult. So if they ingest botulism spores, those spores don't just pass harmlessly through, they colonize, they reproduce, and they churn out that paralyzing toxin directly inside the infant's intestines. Early warning signs are often constipation, reduced muscle tone, and a very weak cry or suck.
Because of that unique intestinal vulnerability, we have another massive, non-negotiable safety rule. Raw honey is a well-known natural reservoir for botulism spores. Therefore, you must never give raw honey or corn syrup to an infant under 1 year old. It is an entirely preventable risk, so just don't do it.
Section 4, Rabies, a race for prevention. Okay, we need to accelerate our pacing here because the clinical urgency of this virus is just unmatched. This is a nearly universally fatal infection once it takes hold. The rabies virus enters through a bite or a scratch. Globally, dogs are the most common source, but here in the US, it's most often hematophagus bats. Once it gets inside, the virus travels incredibly stealthily along the peripheral nervous system directly up into the central nervous system, causing severe brain inflammation, or encephalitis. Most commonly, this shows up as furious rabies with extreme agitation. Then, the virus actually travels back out to the periphery, heavily concentrating in the salivary glands, which explains the hallmark hypersalivation and those intense throat muscle spasms. I'm going to slow down for a second here because this is absolutely crucial. There is no treatment once symptoms begin. None. Once that virus reaches the central nervous system and clinical signs actually show up, the survival rate drops to virtually zero. This chilling reality means that prevention isn't just the best option, it is literally the only option.
So the crucial point is, because it's universally fatal, our only real defense is post-exposure prophylaxis. If someone is bitten or scratched by a wild animal or an unvaccinated pet, the clock starts immediately. Step 1. Provide thorough, aggressive wound care within 3 hours of the exposure. Steps 2 and 3. Immediately administer the rabies vaccine and the rabies immunoglobulin. This effectively stops the virus in its tracks in the peripheral nerves before it can ever make it to the brain.
To really drive home how stealthy this virus is, just picture this scenario. Say you find a bat in the room of a sleeping child. You initiate that entire post-exposure prophylaxis protocol immediately. You do not wait to find a bite mark. Bat bites and scratches can be completely microscopic and go entirely unnoticed. If they were in the same room, you assume exposure and you act right then and there.
As we wrap up this explainer, I want you to stop and think about this for a second. We've looked at Reye syndrome, tetanus, botulism, and rabies. We've seen brain swelling, lockjaw, flaccid paralysis, and fatal encephalitis. So what is the fundamental thread that links all 4 of these devastating neurological perils together?
It's this: they are all extreme, incredibly high-stakes emergencies, but they are entirely preventable. By simply knowing to check medicine labels for hidden salicylates during a viral illness, by keeping up with routine vaccinations and cleaning wounds properly, by keeping honey far away from infants, by acting immediately if you find a bat in your house. This isn't just medical trivia, you guys. This is highly actionable knowledge. Understanding the science empowers you to make simple, everyday choices that can quite literally save a life. But it really makes you wonder, what other incredibly dangerous yet entirely preventable medical perils are hiding in plain sight in your everyday life?